All right, welcome back. Now, stay-at-home orders for non-essential workers, though well-meaning, are proving to have an adverse effect on those who are in volatile home situations. Gender-based violence cases have been on the rise since the pandemic hit, with other restrictions like social distancing making it more difficult to reach victims who need help. Well, tonight, we discuss how the government directives meant to curb a public health threat are inhibiting access to other crucial health services for pregnant women, for instance. And we take a deeper psychological look into why domestic violence cases are increasing. Let me introduce my guests really quickly. I have Dr. Christine Sadia, who is a gender and public health specialist, as well as Dr. Oscar Gidua, who is a forensic psychologist. Thank you both for joining me this evening. Dr. Gidua, let me begin with you because there was a lot of chatter on social media, a lot of people talking about the increase in domestic violence. We saw some suspected cases as well that really riled up a lot of Kenyans, wondering what is going on. I mean, this is not a new phenomenon, if you will, because it's happening across the world. But for the Kenyan case, in your view, what do you think is fueling the domestic violence cases here?
Thank you so much, Victoria, for having me on the show. You know, domestic violence in these times can actually be explained by many things. First of all, the whole world is in a situation where we've not been before. And confinement is not really what the human situation calls for. We're social beings, and asking people to be in their homes locked up really might actually start exacerbating some of the things that we're seeing now. Now, in terms of the Kenyan case, I think we're human beings as well, and I don't think that it is unique to Kenya. However, confinement for human beings normally seems to bring up tension. And if you imagine, if you're talking about domestic violence, and especially intimate partner violence, even if there are times when people disagree, the problem of putting people in one confined space for long amounts of time does not give us the time that we require to actually cool off. So if people have an argument, for instance, they don't have a time, a chance to walk it off, for instance, or to actually go and talk to other people who might actually be more reasonable to calm them down. At this time, what you're doing is almost having what I want to call a pressure cooker effect. So you have one argument and then you add another one. So the pressure builds up and then you end up seeing this sort of violence. And I know that when you ask about violence, Victoria, there's a physical type, but I think that violence is across the whole spectrum. You're talking about physical violence, emotional violence, you're talking about mental violence. There's a lot of other violence that really is happening in the homes right now. So I think for us, let's think about confinement as the first thing. And human beings not being so used to being confined as we are right now. I think the idea of physical space is so key. So the closer people are together, the more likely there will be for it to be, to have conflict. So I think that's where we have to begin the conversation. Thank you, Vicky.
Right. And you mentioned the different kinds of violence. So not just physical, the emotional, mental, economic. And I just want to raise a recent study done by, or I should say data, by the Center for Rights, Education and Awareness Crew. And this is data of gender-based violence cases reported to their hotlines between March and April. And specifically for Nairobi, they found that most cases, at least that were called in or reported, were of an economic nature. If you can kind of go deeper into what that even looks like and why that could be the case.
Is that for me also?
Yes, that's for you, Dr. Gidua.
Oh, great. Okay. So I think we also have to think about what we might think as triggers for some of this violence. And I like to say that many times when people are being abused or they're being attacked and being assaulted, they might want to blame themselves. In reality, the perpetrator is the one to blame fully. And let me speak a bit as a psychologist now and say that sometimes when someone is a perpetrator, they have other issues as well. A good friend of mine normally says that hurting people hurt people. And that's what we have to see. Right now, when you see the economic imbalance that's happening, people losing their jobs, people getting furloughed, companies laying off, asking people to take pay cuts, that also can have a lot of stress on people. And because some people do not have adequate coping mechanisms, they choose to take that out on their spouses if they perceive that they're probably using the money badly or they're not understanding the situation. And in many times, economics even when there was no pandemic, has been seen as one of the biggest issues why couples fight. So alongside communication, economics rises up there to the top. So I agree with our crew study. As a matter of fact, if you look around the world, the data is showing that reports are going up by a bit of a median of about 20%. In Kenya, we know places like GVRC and other places are reporting a threefold increase in reports. So for me, I think that the economic aspect cannot be overlooked. So the virus is the virus. Yes, it's causing a problem, and we need to really take all the measures we must. But we need to really think deeper about the economic aspect of it, because these economics, especially for men, and we'll talk probably later in the program, gives them a sense of identity, gives us a sense of identity. You know, the job someone is doing, the work they're doing, being able to provide for family. So if you start taking that away from them, then you're starting to take away their identity. And with that identity comes an injured ego, an injured way of life. And therefore, the person who actually gets the physical or the emotional abuse gets some sort of displacement from them because of these other psychic things that are happening to them. So I think that's the easier way of looking at it for now, but we can go deeper later. Thank you.
All right, Dr. Gidua, let me go to you, Dr. Sadia, and kind of stay on that economic vein, if you will. You've seen a lot of people laid off, as Dr. Gidua had mentioned, and many women who are in temporary jobs, they rely on daily wages. And you'll find in times of crisis or a pandemic like this, women and children tend to be affected more adversely. You know, when we're looking through the gender lens, if you will, and the impact of the measures to curb this pandemic on women, what are we seeing right now?
Thank you, Vicky, for hosting me. And I would like to pick it from where it has already been put. It is a public health emergency, of public health intervention. Unfortunately for us, those interventions that have been put by the government are the public health measures that will help us to curb the COVID-19. But however, I would like to say that the mitigation measures need to go along. And within the gender lens, there are certain categories we are not, the effect of COVID-19 is going to affect various people differently, whether they are men, boys, girls, and women. And in this scenario, the one that we're talking about, economy, we have found that people in informal jobs or informal, in less paying job, unfortunately, the indication or the studies that are coming up, men tend to lose small jobs because if they were informal, lower grade or upper, women are in that situation where they were informal day-to-day earning. That means that with the lockup, they do not have expendable income. And some of them are putting food on the table, and their spouses are usually out of where they are. So it's like now, like the pressure cooker effect, where you have been locked up with somebody whose emotions are not stable because they have either lost the job, they cannot go out and socialize with their friends. And also when you are now asking for money, that is now a trigger. So the household dynamics, gender dynamics have shifted. And that is why there's a lot of issues that we are seeing. So in terms of, and then also a Kenyan scenario, which then we would like to paint is, sometimes there is the cushioning that comes from your spouse. You bring, I bring, we put it together. In other scenarios, in the informal settlement, the women have contented with their situation. They provide for families. And that is now not there. So even the women are stressed as equally as men are stressed. And any small trigger, and the fact that you could ask for money while it's very far, and a male ego is that he can provide with his friends when he's drinking, he can send money on M-Pesa. But right now he doesn't have it, and you are next to him, and you're saying, bring money, and the children are around. Of course, definitely the next thing that is the normal reaction that a perpetrator would do is to either kick or to give you a slap. They have no way to reason out and say nicely that you can. So that is masculinity, power relations come in on a gender dimension. Women also tend to now be a little bit aggressive. I want to feed my children because the survival of their children are threatened. So this is what is in the is playing. And because the world is not looking at you, there is not a big brother eye that is looking at you to give you deterrent not to slap. Therefore, then the slap and the kicks come in. So it's gender-based violence, but a lot of it is intimate partner violence and domestic violence that we are seeing on the upside.
Right, Dr. Githua, let me bring you in because Dr. Sadia described a pressure cooker scenario, and I see two comments here. One from our SMS line saying violence is high because some couples never stay at home for the whole 24 hours. Another one here from Matthew Mutiso on Twitter saying they didn't marry or cohabit because they cared for each other. They're together for convenience. No family has literally starved during this period, but violence has erupted due to miscommunication of previously held issues. Does that play a role? Maybe reasons as to why people come together in the first place, Dr. Githua?
Well, I mean, that's a really hot button issue. I think the pressure cooker effect that the good doctor and I are speaking about is really exacerbated by those things. So for instance, those who've heard me speak before about relationships, I normally tell people that just the fact that I've told you that I love you and let's live together, that's not a precursor to a happy life. Now, let's even make it worse. Let's put you in a scenario where you have to be together for 24 hours, like the person who has written is saying. If we do not have our inherent, or at least the friendship we've worked on, or at least if we've not talked about what is a responsibility of cohabiting, because I don't think that the only pattern is marriage. Of course, that's one that's really most known, but people who are cohabiting many times will cohabit for convenience, and it's not convenience for any other reason apart from maybe economic reasons. They want to save on rent and other things, raising children together, which are all legitimate reasons, of course, for them. When they have not worked on the reason why they're together, if an issue comes up where those egos that Dr. is talking about come into play, both men and women will tend to become more aggressive, and it's easier to think of a way out. And the way out is to become an aggressor. So perpetration is going to be interesting. I think for us, when we've studied gender-based violence, when we've also studied domestic violence and intimate partner violence, we've seen attacks mostly by men against women. It will be very interesting during this pandemic to see if there'll be any shift in terms of a gender balance of who's doing what, because I think what the doctor has raised is really, really, really interesting about even women being in that category of people who are now, empowered, but then they're also disempowered in some way, people being in the same space and then asking each other for that economic relief, and they cannot be able to provide it. I think if people have not worked on their relationship, if they're not deliberate about the outcome of what they want their relationship to be, which is to raise a family through thick and thin. And also, Vicky, I think that when people are saying vows, I don't think they really know what they're saying, through sickness and health, through wealth, and, I don't think people really dig deep to think about what they're talking about. So I think for me, that I can actually agree with, and I can say that it might give a chance for people to be deeper in the way they think about their relationships and work on them as well. It's actually a chance for those who see the chance. But for the people who are in a violent relationship, of course, it's not the time to tell them to work on their relationship. But we can see that might be one of the missing links.
Absolutely. And we'll be talking about, what those in those volatile situations can do to alert someone that they are in trouble, because it's difficult if you're thinking about being in a place, a small space, where the perpetrator, the aggressor, the abuser has taken your phone or any other device that you can use to communicate with the outside world. How do you get your SOS message out? We'll come to that. But Dr. Sadia, I need to bring you in on this, because whenever you come to a scenario like this, a pandemic, where a lot of the energies, resources, funds go to fighting one problem, many other services, health services, kind of fall through the cracks. I was speaking with a nurse who said that she had to treat some pregnant women privately or secretly because a lot of the energies were put towards dealing with COVID-19 patients. What do you make of that, especially at a time like this?
We have looked at Ebola situation and the Zika, and that is true. A lot of resources seem to be diverted to other more priority, like now the COVID is the enemy that we have to fight with all the ammunitions that we have. But we still have very basic and very crucial services that must be offered. But because of that shift, including the human resource, you find that the pathways for treatment or referral pathways or places of care are already blocked. So that then gives you a problem. And for us, looking at the scenario of pregnant women, in the first 1 week of the lockdown, we already had seen issues. The media had already reported a lady that had been lost. The children, people were delivering out of the care facilities. But also you recall that the stigma that has come with the COVID, the way the COVID has been introduced, has brought in a lot of stigma, including stigma of care places. And today you had the good CS talking about people are not going to places of care. That means that we need to look at alternative referral pathways or care pathways and make them more receptive to people who would like to use them. Another thing that is happening, incidentally, labor seems to happen mostly at night. So you find we are in a curfew. People are, and the way that the curfew started with the strict measures that it came with, scared a lot of people. So people don't want to venture out of their homes. They say, okay, hold on with your pregnancy, with your labor. We hope that by morning we will be able to reach a place of care. And by the time you are reaching, it's too late. So really, we just need to figure out how do we find alternative referral pathways? How do we open up spaces for care? How do we find psychosocial support or hotlines that will help people? But like you are rightly saying, if you are with a perpetrator at home and it is a case of intimate partner violence, you are not able to use your phone because the suspicion of each time, who are you calling? Who are you calling is going to come into play. So we need to find alternative ways. Is it an SMS? Is it somebody who will call on you? We already are documenting quite a lot of people who are locked within their homes and they have no valve. You see the pressure cooker, if you don't put the pressure out, there's no way you can escape. So they are roasting within, but there are no support system that can reach them. So we need just to figure out where are the alternatives that we can put in place as we are fighting the COVID. Because the measures that are there are good enough for us to contain the pandemic, but we must find out the alternative ways, pathways of referral, of care. I'm sure the same are with men. They are also trying, because there's a study that has happened from where the COVID has been before. Men could not find care, but women took more time to find care. And the fact that women do not have insurance nor money, ready money, the saving culture amongst the women, particularly in slum or on the lower socioeconomic bracket, then comes into play. They suffer, right. And we need to look out for them.
And speaking of looking out for these individuals, these victims, Dr. Githua, just back to that question on how to get them the help, because if you're talking about social distancing and ensuring that people keep their distance, how do you rescue someone, put them in a safe house, for instance, where there's, concern about transmission of the virus? How do you practically rescue someone from a situation where it's volatile and hostile?
Well, thank you for that. I think that's a very deep question that we have to go deeper into it. And I want to, first of all, echo what Dr. Sadia talked about regarding health-seeking behavior. I want to agree that people are now afraid, sort of. And I think that the Ministry of Health is thinking right now as we speak about how do we encourage Kenyans to go and seek out this health services that they require. I also think that right now it's a time for the president's team, I believe, to unveil, the universal healthcare package he's been really talking about. And I think it's a good chance to talk about the uncovered people, the people who do not have healthcare insurance, to start getting it, vulnerable populations, and especially when you talk about women and maternal health care. Now, to your question, Vicky, about how do we get help, it's time to innovate. The truth of the matter is that, the scenario you've painted is really tough. If somebody is monitoring my phone and it's the only tool with which I can actually be able to get some help, then it becomes very difficult. And I think it's time for us to start thinking, is there a way we can start utilizing Nyumba Kumi, not only just as a security thing, but also as a safety thing when it comes to questions like domestic violence? Is there a household? Is there a neighbor? Is there somebody who, if I walk out in those very close those places where probably the toilet is outside, if I want to go to the restroom, and unless the perpetrator is taking me to the restroom inside, can I be able to just walk out and signal someone in a way? I'm not saying that I have the solution yet, because the world is in the pandemic together, but even the studies we're seeing from all over the world are reporting to us that traditional measures of getting help for survivors of domestic violence are not really filling the gap properly, because the previous thinking relied on traditional rhythms of someone leaving the house, going to work, and therefore you having a window to be able to go to a safe house. But right now, because that is not there, we need to innovate and see, who do we use within our community? Who do we use within our neighborhood, our neighbor? Is there someone we can actually trust to be able to become the conduit for getting us help? Because again, I also want to say this, Vicky, that I think I want to also encourage anybody who might be watching this right now and is going through a situation like this, that domestic violence is also an offense in this country, especially when you look at it from a standpoint of assault. However, I also know that it's hard for someone who's actually a survivor to report who's abusing them. Sometimes there's a lot of fear around it. And so it's not easy to just report someone, because there are many other psychological chains that are actually binding someone that wouldn't just let them go and report to a police officer, for instance. And like you've said, because most resources have been diverted, that might not be what we call a priority issue right now. Definitely one that needs to be talked about. And when we talk about how do we help the whole system, probably that's something I can touch on. Thank you.
Certainly. And Dr. Sadia, before I bring you in, I want to play a bite from Grace Wize from Equality Now, talking about the increase in child marriage, especially during this time of the night curfew. Take a listen to what she had to say.
Schools are closed at the moment, so there are many girls from vulnerable families that now are staying at home. So as I mentioned, this will be seen, families will feel really a great financial burden in terms of feeding their children. So they will definitely look for a way out. And one of the ways out is to marry off their girls.
Sadia, a very grim situation there, where some families are resorting to marrying off their daughters, their girls, in exchange for dowry because of the tough economic situation they find themselves in. How do you respond to something like that?
Thank you very much. Let me first of all weigh in on the issue that you had asked about the safe spaces or the rescue centers. Already we start from a point of disadvantage, because we didn't have them. Most of them were private. And when the issue of social, I call it physical distancing, came in, because the social bridge needed to have already been left to kick. That is what helps you survive in a situation like this. So the physical distance issue came in. They sort of like either closed or they took fewer people. So meaning that they released some of the people. So the situation that is even compounded, that the girls that were even rescued and now are back home. So we have already started hearing report of FGM. They ran from FGM. Now they are being FGM back because they are with their families. Now we have also started hearing reports of early marriages in some communities, like the Somali and the Borana community. We are hearing that. So we need yet to confirm, but already anecdotal evidence is showing that that is happening. So with the case that you are saying, early marriages are happening, like she's rightly said, because if you do not, and this used to be there before, and that what COVID has brought are the gender issues that we thought that we had already overcome. It is now confronting us to go back a few steps backwards. There are certain areas that it is opening, like the spaces where we can work home with IT and communicate, but there are also areas that where it is reinforcing, but most likely in traditional communities or people who are on the lower bracket or on the fringe of poverty, they will resort to whatever that they have. They have lost jobs. The girl is at home, she's working, somebody is coming for your daughter and it's offering you. And I'm sure it is peanuts, it's not a lot of money. So what the research has shown during Ebola and Zika is that when the schools were opened, the girls, the majority of girls and number of girls never reported back to school because they had been married off or they were already pregnant. So that is something that we need to manage. But I agree that it is something that is emerging. If they already have evidence for it, I cannot dispute. I think it is okay. It is something that we had anticipated, and we just need to mitigate. So within the response, then we need to engender the response. The response must do a critical gender analysis. What affects women differently, boys differently, men differently, and we begin to look at coping mechanisms and put the social protection measures in place. So these are things that, as even as we are running with the science and with the case management and with the quarantines, we need to now begin to look at the other aspects within the risk mitigation. How do we mitigate these risks that are confronting us within the response that we are undertaking? And unfortunately, we are getting a complex response because we have had floods. Now there are diarrheas in some places. There are displacements in some places. How then do you even program with those places? It is a complex situation, and I'm sure the government is not also finding it easy, but this is where we need all concerted effort to think out and engender this process. So for me, my biggest asset is we begin to look at the gender analysis, assessment, and engender the process. Right. Can we find out how then this can work out for us?
All right. And Dr. Githua, I'll give the last word to you. You know, oftentimes the focus is put on the victims when it comes to these domestic violence situations, as it should be. However, we forget to address also the aggressor or the abuser in terms of maybe alternative ways of taking their anger and aggression and solving conflict. How would you advise them to, at times, maybe walk away when it gets heated up?
Vicky, it's complex. I think in my work as a forensic psychologist, I've spent many years working with people who've done really terrible things. Many of them, unfortunately, have been men. And as we were talking earlier, we've said about questions of triggers that actually set people off. But if you really think about it, the underlying emotion of anger is one that is very addictive. And this one can be seen in the kind of cycle. Every time a perpetrator commits an act of violence, it normally starts at something very small, and then it goes escalating. It becomes bigger and bigger and bigger until by the time we're reading that someone killed their wife or their child or whatever, there had been other incidents of increasing magnitude before that one. So what I can actually say, it's really hard, and because I think that one of the ways of speaking to perpetrators is not normally addressing them directly about, you know, stop doing this. It's normally saying that, look, I understand that you're probably going through something hurtful from your past or something hurtful yourself. Probably you imagine the world is sinking on your shoulders as we speak. But the reality is that everybody else also is. And it does not really benefit anybody, including yourself, to take that out on an innocent child, an innocent girl, an innocent boy, and even an innocent spouse and a wife. All of these people are someone's children as well, and they're your children. And I think for our country to actually move ahead, to have a chance to actually be grounded on our families that we really value so much, I think one of the things I can tell perpetrators is, look, all of us are in this situation. Let us just tone down. When you feel like you're actually starting to get angry, the pressure cooker needs to actually, you know, remove some of that steam. So we're not going to stand here and judge you, but we're going to say, just take a walk, get out. I know, yes, we have curfews, but stand outside somehow, take a breath and come back and think about, who is this person that I'm putting my hand on? Who are they to me? And many times that perspective in the heat of anger is usually lost. And when people take a step back, we've seen a lot of good work, even with young people who did not know how to take and think about what their moment of truth, the moment they could have stopped that violence, what they could have done. So when we speak with men that way, and even women who are actually aggressive, we find that we have a lot of good results when people actually take a step back. When you feel that angry, take that step, take a pause first before the action. And you find that that also really cuts down on that very impulsive reaction, which delves into anger. And I also want to say, probably if you allow me, Victoria, I don't know if we're going to have another round, but I think that the whole country is going through a feeling of loss as well. It's not just a loss of jobs, it's a loss of a way of life, a loss of what we know is African, like meeting each other, getting to see your sisters or your cousins, or going to your chama, going to your religious service. And that's what really you're seeing. You're looking at people reacting to loss. It's almost like mass grief. And so it becomes really difficult to intervene at an individual level if we do not want to look at the community level. How do we restore people's hope? How do we restore people's longing for the time when we actually get out of this quarantine situation or the curfew situation. So I think we have to also think about community type of interventions. If we have time, I'll tell you what is already in the pipelines. But as of now, thank you so much.
Thank you so much, Dr. Gidua. Unfortunately, we are out of time. However, you raise a very important point, which hopefully we can take forward into the next weekend, how populations approach a crisis and deal with those levels or stages of grief that you just mentioned. Thank you so much, Dr. Sadia and Dr. Gidua, for your time. And keep your comments coming. The hashtag is always Citizen Weekend. One last one here before we wrap up from Katebes Kibet on Twitter saying, marriages are going through a hard test. This is a time for patience and understanding, and it's needed the most. Thank you so much for your comments. Thank you for watching as well. Have a wonderful evening. Stay tuned, though. One Love is up next.